Hello, social workers, mental health professionals, and change agents. Welcome to another episode of the Social Work Rants Podcast. I'm your host, Bas Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to the podcast. Make sure you like, share, subscribe, download episodes, however you listen or watch the podcast. If you watch the podcast on YouTube, make sure you hit that subscribe button, also the like button. It helps with the algorithms. I'm trying to get the 500 subscribers on the YouTube. And you listen to the podcast. Thank you for listening. For all my mental health professionals, social workers that work in the long-term care, work with the geriatric population, anything in that realm, medical social work, this episode is strictly for you. We talking about caregiving and all the things that Agent Orange is doing, destroying the healthcare field in terms of home care and all that in between. The power of LinkedIn. I don't know what's up with Threads. Threads, people on Threads can't stand LinkedIn, but I was able to connect to this. My next guest on LinkedIn. Starting to really love LinkedIn because a lot of opportunities have been happening the last 6 months thanks to LinkedIn. Lindsay Friedman, how you doing?
I'm good, thanks. How are you? Thanks for having me on your show.
No, thank you for coming on and connecting and talking offline. We got a lot to talk about in terms of the field of caregiving, something that I do on a daily basis on top of everything else that I do. Caring for my dad and was caring for my mom during the pandemic and work as a certified financial social worker, addressing the needs of the sandwich generation caregivers like myself who are struggling with their finances while caregiving and what affects their own mental health and their own personal finances. So it's a very dear topic to talk about. So for those who don't know who you are, let people know who you are.
So, as Baz said, my name is Lindsay, and I am a multi-generational caregiver. I started caregiving professionally at 18, but I
Mm,
was a caregiver earlier, even earlier, because my mom had MS. And I was the only one who was like, I don't know if it was brave enough. I was like, was giving her a shot and helping with little things really early on while I was still like a teenager. So I really got into it early, and over the years became a grandma's caregiver. I have a chronically ill daughter, so I juggle that as well. And now I am a sandwich generation, taking care of my daughter and my parents, and I work in the care field. So I really see it from every angle you can get it from, and have learned so much about the challenges families face, and the challenges even providers in this industry face,
mm.
and really trying to help kind of bridge that gap and maybe improve it along the entire continuum.
Caregiving is it's like a privilege, but also it fucking sucks.
Yes, some days. And
Some days, yes.
I think it's your relationship and where you are in life can really
Mm,
really play on how that experience is. So caring for my grandma, I was a lot younger.
mm,
I wasn't working as much. I had my daughter was already born, but
mm,
she wasn't really sick yet. So she came with me. It was fun. It was easy. I was really helping my grandma, it was really rewarding. She was
mm,
really smart and had long-term care insurance that, policies were so inexpensive back then and were so robust. So that was
mm.
really helpful. Um, and as I've gotten older and as my career has gotten busier and like in the prime of career, right? I I find myself with both my parents and my daughter really juggling, and more with my parents trying really hard not to get frustrated.
Mm.
right? And
I
all
know the feeling.
so much, but sometimes you're like, ooh, just take a minute. And I'm pretty good about like, I'm going to take a minute, I'm going to walk away, and then I'm going to come back and ask, for we're going to talk about it differently because my mom is a significant fall risk.
Mm,
And so trying to make adjustments around that, my mom is falling almost on a weekly basis at this point. And it's really becoming a complex issue, even in my family, where I have the tools and have been doing this for so long. So I feel for everyone because it's tough, especially when you got a stubborn one.
yeah, uh, God rest his soul. My mom was definitely a stubborn one, and my dad, he got more lives than a cat. So it was like I need to get my estate plan in order because I think he's trying to outlive me. Because um, I was so I know you had multiple businesses and relates to caregiving. And it's an opportunity for new like MSWs, graduate students who are new into the field, or even like their concentration might be geriatrics. Like there's you could do long-term care. You could there's different insurances like Highmark. They always hire case managers all the time, and you can make up to six figures. Like in those type of roles, and focusing on geriatrics or just in general. So like kind of give a little bit about like your background in the caregiving space and what you're seeing.
Yeah, so I'm really now focused on kind of the technologies that can really help people on a broader scale. Because so I have two companies. One is called CareBloom, and it's a caregiver support tool. It's like virtual monitoring. And I'm seeing a lot of those kind of tools come out, not just CareBloom. And I think the reason we're seeing these digital alternatives is because there is a shortage of professional caregivers, right? Um, the economy, it's a tough place for work and balancing everything. So there's a lot of people who have to still go to work, but are scared about what's mom going to do at home. That is a tough situation.
Mm,
So that was actually Care Bloom is the ability to put a smartwatch on a family member and really monitor them very discreetly. And I would tell any family member looking at a digital solution to make sure that it is discreet because we want our loved ones to have dignity and respect and privacy. And there are solutions out there now that aren't cameras, but to also watch out for what that tech really entails, because if it's just a motion sensor, you're not getting accurate data, at least not yet. So that is one of the big things I'm seeing in caregiving is digital solutions trying to take the place, or not really take the place, to try to help out caregivers because it
mm,
is such a burden. The other company I run is called LT Care Nav, and what we do is we help families plan for care for free, create long term care plans, connect with the people who can help them. And I think this is going to be a change we're going to see in maybe 5 years from now. Because what's going to happen, as you talk about us as a sandwich generation,
mm,
is there's going to be so many of us that are caregiving. It is going to be such a tidal wave of people getting over 80. So many people are going to become caregivers. They are going to be aware of what's happening because I don't think people really totally grasp the fact that long term care is not covered by Medicare, insurance. It is out of pocket. You are paying for it. Um, and really understanding how burdensome that's going to be on families. Hopefully, there are ways to prepare that can make it so it's economically friendly to do this. And hopefully, with your work and some of the stuff we're doing, we really start to educate people on the importance of a long term care plan. And I'm not necessarily saying long term care insurance. I don't want people to go up
mm,
that, right? It's too expensive, all of those things. There's a lot of other great options. And sometimes it just happens to be have a great conversation with your kid. Let's understand what it looks like, your adult child, and see how they play into this. Make them aware of what you want. And so I see both the digital platforms changing the way we age, are improving this ecosystem, and also we're going to see a big change of people understanding what has to happen to make sure that they can ensure the end of their lives are better than they would be.
No, that's so important, especially the National Alliance for Caregiving did a study with AARP, a national study. So, according to their study, there's 63 million Americans who are considered caregivers. At least one third of that population are sandwich generation. So that's you and me on the podcast, talking about it. And yeah, it's a lot, and caregivers are getting younger. Even like
Mhm.
Gen Z folks are being involved in caregiving because they're caregiving for a younger sibling who might have a disability on top of having older, maybe older millennial or baby Gen Xers who have as parents. So uh, yeah, it's a lot happening, and I've seen studies that's going to be as many boomers as 5 year olds in America. So as people live longer, medicine is getting better. So yeah, people living longer, and unfortunately, things like Medicare getting cut, and threats to Social Security. I just saw something on Instagram that, talking again about like Social Security money is gonna like run out, even though they've been talking about that for years. So it's like all these safety nets that are been used to care for folks are always on the brink of the chopping block. So it isn't important to address all these issues.
Yeah, and I think some of these things that they're looking at, where we really get into an interesting dynamic is with longevity, right? The system was not built for us to live this long.
Mm,
Everybody is living a lot longer. And I think the other dynamic that we're looking at is, when our grandparents were having children, they were 22, 23 years old, right?
right.
We're now in, I know a lot of people, you're having children at 40,
Hmm.
45.
Yep. Their
That,
first kid at 45.
yeah, I have a lot of friends who are having kids in their mid to late 40s.
Hmm.
And one, kudos to them because they must be exhausted because I can't imagine having a baby at that age. But on the other hand, that also means we're putting our children, right? Like our children are going to be 28, 30, those people's children, because will be that age when it's time to start giving care.
Mm.
And with longevity, that means there will be 30-year-olds looking to be caregivers for 20 years with longevity. And it's going to play into so much more in so much more of a profound way if we don't find some kind of way to improve the system.
Yeah. Um, Multiple things have crossing my mind right now. I did want to touch on the technology that you have to assist caregivers, but uh, also if things would have happened, or hopefully would have happened, we would have had President Harris as president. And during the campaign, she actually had a plan for us sandwich generation folks. Who knows if that would have been in fruition? Was she at least she had a plan and was talking about it on the campaign trail? So we would have had hopefully something in place for us. But obviously, we're dealing with the orange man who's destroying everything and messing everything up on a daily basis.
Yeah, they're and it's almost been government for a really long time has forgot about the senior population because
Hmm.
we've never had long-term care covered, right? The only option is getting to Medicaid to have some kind of government assistance. And I don't know if that's always going to work. I don't know what the solution is, but with care costing sometimes $10,000, $12,000 a month out of pocket,
Hmm.
the average person can't afford that, right? And
Absolutely.
you even get to a point as, okay, you can obviously take care of your dad now. I can take care of my parents now. And that's great. And we want to be able to do that as long as you can keep them out of facilities. But in cases of like dementia or late stage
Mhm.
Alzheimer's, I think even with the best intentions and even as the best caregiver in the world, you're not, it's nearly impossible to keep them at home safely.
Safely, exactly.
I mean, there are so many things that are just dangerous in your house. I mean, the steps, the stove,
Hmm.
the microwave, everything can become just dangerous, even the door to the outside.
Yeah.
And so there are these cases where there's just no other choice, unfortunately. And I don't know what's going to come of it. I wish there was a really good solution. I wish I could believe that someone was working on this to make something that was really democratized long-term care across everybody. Everybody deserves quality care and everyone deserves that dignity as they age.
No, absolutely. You mentioned your device to help caregivers. I know part of that mentioned was due to the lack of home home care or HHA workers, and I know that that's always been an issue, even like way before COVID happened. But COVID took it to another level. Obviously, so no germs and stuff like that. I don't want nobody who knows they're bringing in the COVID or flu or everything in my house. Like I don't want that. And people became low key, germaphobes, like, and rightfully so because nobody wants to get sick and things like that. So, but there's a lot that goes into it. And now we have a shortage of workers, and at the same, we already had shortage of workers prior to pandemic, and pandemic took it to another level. And then add that to the fact that a lot of the HHA workers or immigrant, at least from my experience living in New York, and working in the medical field in New York. So obviously that has with everything that's happened with the immigration and ICE that's happening right now. So there's a everything is all like kind of like intertwined. Like putting my fingers together or intertwined is a lot that's happening. What relates to caregiving from that aspect.
Oh, we are in the perfect storm right now. We really are pulling from it at every point. And I believe that, we pay our caregivers, our home health aides, our nursing assistants, they're not paid enough,
No, not even close.
right? They do really hard work. And we don't appreciate what they put into it. And I would say almost everyone who goes into this is coming from a good place in the beginning. They truly are, because you could go work at a fast food restaurant or as a janitor and get paid more. And so to give these people at least the respect they deserve from what they're choosing to do and what they're willing to give, because caring is giving. um, I think I think people who are paying for the care are not respecting them enough. I think there is a dynamic between care recipient, care family, and home health aide or nursing assistant that is not valuing the work that these people are doing. I think the organizations, more as it comes to the facilities, are trying to get away with as few staff on the floor at a time.
Hmm.
And that breeds an unhealthy, unsafe work environment for them as well as for the families that the people they're caring for.
Right.
and with the lack of it, and with taking them away the way we are, people who want to do this job. I mean, to pull them out of our country when they're giving so much, it literally at this point, we are not supporting this industry. And by not doing that, we're all going to have a really rude awakening when you want to put mom in a nursing home or you need help and there's nobody there and they're telling you it's a month to get somebody. Well, that means you're showering mom for a month, or
Hmm.
you're going to be doing toileting in a way that you never really expected.
Yeah, uh, and the circle of life comes at you real quick when you're like, the bathing and the toileting, and if you're a parent, you're a sandwich generation, you think you done, changing diapers, and now you're changing diapers for mom or dad or grandma who you've been taking care of, and it's like you got to do it, and it's like there's nobody else to do it. So I I I had to do it for a little bit, and it was rough. It was a lot of taxing, like physically, like mentally. It was rough.
It is. It's I hope people who do hire home health aides are understand what their role is and understand what they're giving and really are respectful to them. There has to be boundaries. I think that should be really clear
Hmm.
to help the home health aides and to realize like it's hard for us to take care of our family members. Remember, this is somebody who's coming in who doesn't love that person the same way you do. So make it easy on them.
No, no, absolutely. At the very least, it's and I know there's like frustrations. I know I had frustrations like even like when my dad is like,
Mm.
uh, they they can't cook, or like many agencies are like they don't allow cooking. It's just basic like cleanings and things like that around the house, or just making sure like if you're gonna shower, I'm standing outside the door, like in case something like does happen, like potential fall or whatever, like to make sure they call 911, something like that. It's like just providing that education so that like you mentioned boundaries, that the workers are not doing extra what they're not paid to do.
Yeah, you want to treat them as well as possible, especially if you get somebody who seems to care because they're hard to come by. So treating them well will serve you in the long run.
Yeah. So now I talked about the president and everything he's doing, but obviously he was president during pandemic as well. Like, talk a little bit like your experience in terms of caregiving and your businesses during that time.
So for us, we had actually just gotten a product, not a beautiful, we had our like first run of products. We had just gone through R&D and we had a product that we started putting in facilities, nursing homes, assisted living, and testing out a theory. So actually what we were really focusing on is the efficacy of the product. And can I really make ensure behaviors of both the patient, we'll use it, the patient on this end, that I'm really able to track their behaviors. And then we were also tracking staff in these situations to see if we could really understand what that looks like, what behaviors looked like, what compliance looked like. And because what we were anticipating at the time was that if you toilet in turn in the ways that you should, right? If we make sure that tasks, the ADLs that need to be accomplished were being accomplished, that we could prevent bed sores. We could improve
Mm,
quality of life. We could improve, keep people out of the hospital. So that's why we were really testing at that time. And it ended up being a really beautiful test in most cases. We were able to bring like compliance up to like 97% up for
mm,
burning. And we found that when we were in these facilities, the big difference was while we were monitoring these things is that the facility made sure they were better staffed. We saw a difference in staffing to accomplish
mm,
during monitoring. That made a huge difference. Um, and then COVID hit, and we were still in the middle of testing. We had an idea of really improving care in these ecosystems. And then COVID hit, and they basically were like, nope, we're done, get out. Okay. So they were very nice. They put all my stuff in a box, all the places I like went, and they like threw them outside at me, and I was
Oh my
able to
God.
collect it. And my team and I were like, okay, I think we're out of business. Like there we can't go back here. Like who knows? So we kind of like twiddled our thumbs for a little bit. And then we looked at each other and we were like, listen, everyone's going to want to stay home. Like we started hearing about all of these things happening in the assisted livings, and you couldn't see your family, and everyone's
Hmm.
going to come home. So we were like, what if we take this and turn this into a home product? Because we saw a movement of people are going to want to age in place, especially after this. So we really kind of redirected ourselves at that time and became a, something that could help people age in place. And that was really our market. We were helping families monitor and track and take care of their family members at home. And now we're seeing this movement of more accepting of digital products. And with the caregiver shortage, because of all the stuff that's going on, getting so it is just increasing drastically quickly,
Right.
that um, home care companies, to stay alive, what they have to do is they have to have billable hours. They have to
Hmm.
bill for the time of the care provider. And if there's no care provider, then there's nothing they're building. And then it kind of goes up through, the trickle effect. So
Right.
we're providing a solution because to home care companies where they can actually take our devices and put them in homes and then monitor those devices. And then if there's an issue, they go out at the point of an issue and not, and but they're able to monitor 100 people at one time. So now there's a solution that is tech based that helps to at least put a little band-aid on what's going on.
Yeah, that is so cool. And it's also like, so needed, and for you to, pivot with your business. And I know pivot was like the buzzword in 2021, but you literally legit had to pivot, and came up with a solution that is needed in households, and still needed in households, because home care agencies are struggling. No long-term care agencies, at least in New York, like 2016 to like 2020, and before pandemic, were like closing down or having to merge, for because care the rise of medical costs in terms of caregiving is so expensive, and it continues to be expensive to this day. So it's definitely a much needed service that you're doing.
Well, thank you. We think so.
Um, Now you mentioned, earlier about you know a way for like social workers to get involved or a way for social workers to, in terms of your other business that you had going on. You tell a little bit about that.
Yeah, so we have multiple ways that we can work with social workers. And I'm just going to say, I think you guys do some of the hardest, most meaningful work there is, right? And one of the things I know, at least hospital social workers, is that you spend a lot of time giving out recommendations, right?
Hmm.
Who to go to. And sometimes that becomes pretty tedious, right? You have limited time, you're servicing a lot of people, there's a lot of need for what you do. And so we're really trying to make it easier for social workers as being like a one stop shop. So if you have anyone in the elder care space, geriatric care, long term care, we are building out what you would do is you would give them access. All you would do is say to them, hey, listen, I know you need some help. Check out LT Care Nav, create an account, and then we on our end set you up with everyone you might need on the continuum. We are not mass lead generation, so we're not selling your data. We provide you the information. So we take a small report, we give you an idea of where you stand, what it looks like. what you might expect from your long-term care. And then we give you different people who can help in your area. And I think what's really nice, just like you guys do as social workers, is on our end, we're vetting all of our professionals. And so you, as social workers, can trust that I've met with every one of my providers, be it a home care company, a placement company, a community, a estate planner, everybody. We go the entire continuum. And when we
Mm.
make referrals, it really makes it so you don't have to do that anymore. It's a one-stop shop. And so you don't have to have families returning going, now we need this, now we need this. We just cover it all
Mm.
for you.
Oh, that's great. Like, because that is a lot of work. We try to find all these different resources, and every state and every city is different. So people might not have like, or communities might not have resources or such resources, and they have to go out of state for stuff. So like a one-stop shop for everything would definitely be very useful, very helpful, to say the least.
We're really trying to make the we're really trying to serve the entire ecosystem when it comes to long-term care. The families, the providers, the social workers, the caregivers. We're really trying to kind of between the two solutions help make everybody's lives easier because it's already hard enough. And if we can do little things, I think it makes a big difference.
No, absolutely. Has a caregiver, what do you, I guess, from a macro perspective in terms of on a national level, what you like to see happen to make your life easier, not only as an individual caregiver, but also regarding like, your business.
Um, I think for myself, Um, that's an interesting one when it comes to myself because I think what most people need is a plan. And um and because I do what I do, I've been able to really help my parents with that. And there's an understanding. And my mom's still stubborn about things and there's still things that come up even with the experience that I have. But I think for me, what would I really like? Hmm. Better, I mean, the whole system. It's a broken system, right? So,
Yes.
so as I said earlier, my daughter's chronically ill and she's had a really bad flare up. And I called to get her into the doctor and I said, we really need to get in. And their response was, okay, we have an appointment 2 weeks from now. So, and I went, oh, okay. Yeah, I think she'll be better by then because it's a flare up and I just need to get some medication for her. And so I think for me, the the way the system works is not ideal. And that's
Hmm.
I guess it's not for me, it's for everybody. And
Hmm.
that would be something that would change how my days go on a daily basis is if the system was more accommodating to patient, was more patient centric instead of like revenue centric, I guess would be good.
No, yeah, because that doesn't make any sense. Now you're like, okay, a flare up. Now you start going to the ER or urgent care. If you go to the ER, like it's
Yeah,
the
cost a fortune.
flu exactly, and flu season's been kicking everybody's butt. So now you're like, okay, I go to the ER for a flare up now. Now I leave. Now I get the flu. Now I probably have to go back to the ER because I got the flu now.
Well, so she wanted to go to the ER and she was like, Mom, I'm so sick. I need to go to the emergency room. And I was like, oh, I don't know what to do for you, baby, but I don't want to go to the emergency room. I'm like, I think you're gonna live. This should be okay. Yeah. So we're riding it through the best we can. But I think that's a big thing
Mm,
that I think every family faces in situations.
yeah, like for me, my head goes the aftermath of what the one big beautiful bill is going to do in terms of Medicaid and with all of the cuts, the current cuts already happened, plus the rest of the cuts that's going to happen in the fall. and what does that aftermath actually, look like for folks? And especially, I think about um, the PACE programs that rely on their participants that have both Medicaid and Medicare, and potentially they might lose Medicaid. So like, it's like the trickle down effect of like agencies potentially closing, or people not having health insurance, or costs would even be more expensive than it already is. So like, I'm thinking already like that far out.
And I think everybody's really going to have to. And I'm just going to, for full disclosure, I'm by no means an expert on health insurance or
Mm,
Medicaid. I really focus on that long term. So even some of the navigating I do in the healthcare system with my daughter is pretty complex and throws me sometimes. But I do know my daughter has she's got a couple rare diseases, and one of them requires this injection every couple of weeks. And we're very fortunate. I mean, there's no choice. Our health insurance went up, but you have to have it. But I'm looking at the people who can't afford to keep it, or Medicaid, where I hear it's a medication that's really being cut. I feel for those kids because her quality of life is so much better with the medication. Like she had very little quality of life for a long time without it.
mm,
And so I'm really worried for there's a lot of children who are relying on these things,
mm-hmm.
be healthy, to have a life, to thrive. And taking that away seems it just it's so unfortunate.
Yeah, it really is. No, I work with a lot of kids with complex care, and kind of see that, and having a special needs nephew, who's always getting sick. So it's like it's a lot happening on the federal side, which trickle down effects to the state side, and depending what side of the aisle the state is in, that's going to affect even more quality of life issues. It just continues down the trickle down effects. So it's a lot on the horizon, and it is to educate folks, because the government is purposely like, you know this is happening and this is happening, and the media is following the same thing, and it's like, all right, we're not addressing the real issues, the day-to-day struggles of folks, and what potentially is going to be happening, whether it happens or not, that by at least having those conversations like, hey, this might happen as a result of this that's happening now. So it we're I don't think I ever lived in a more uncertain time than now. I think like 9/11 was as close as I've been to like living in uncertainty that I'm living right now.
No, I totally agree with you. And I think what you want to know where I think a brunt of this is going to fall on is the social workers. So, social workers who are listening, I think when this starts to collapse and when people become desperate, you guys are going to be so needed, but it's going to be a lot for you to sort through because they're going to need so many more social services that are available, or you're going to be having a lot of people that you're going to be turning away, even of like, I don't know what to tell you. So I see a lot of that falling onto you and your audience, and I
Hmm.
feel for you, for what's about to come. And I give you a lot of kudos for doing what you do because I know almost all of you are going to handle it with grace because you're coming from such a good place. And I think you're going to be part of what holds up the communities.
Yeah, that's a lot of us, what we do day in, day out, and for MSW students and new social workers coming into the field. No, we we are just tough times we're coming into, so it's definitely a lot. Where can people reach out to you? They want to know more about the device. No. I actually have a couple people in mind that for you to contact in terms of like reaching out just to at least have an introduction in terms of you know, those your device and home
Yeah.
care. Where can people reach out to you?
So I think the best place would be ltcarenav.com/podcasts. So with an S at the end. So maybe you could throw the link in there because also for your listeners, we are going to give away 25% off the monthly fee for Care Bloom. And then we're also offering a free ebook because I know you and I talked earlier that I wrote called Plan Today, Protect Tomorrow. And it really opens up the idea of what you should look for in your long term care plan, why it's necessary, the conversations you should have. So both of those are being offered on that site. And once this video goes live, you'll also be able to see Baz's and my conversation again on that page as well.
Awesome. This was a great conversation, much needed conversation. I hope people get a lot of gems from this, and there's a lot happening. By the time this episode ends, who knows what's going to happen in terms of caregiving? That's what this administration does. Is like hold my beer. I'm going to do something else crazy tomorrow. So it is what it is.
We're gonna all get through it, and hopefully, with the support of if you, I'm happy to support people understanding their long-term care plan, and with the support of all these social workers, we'll make it through to the other side.
Hopefully, in God's will.